The I, she stopped at Starbucks on the way in. She met a new best friend. She got completely distracted with time and she forgot.
Right.
That's the I.
This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice.
Gary, my first question to you is, I've heard you talk about the DISC personality styles. Can you give me some tips for me and my team on how correctly to identify the personality type of our patients?
Yeah, so let's go into that. Obviously, we don't ask the perfect thing to do would be to have your patient take that 28 question test. I would say that would not be appropriate in the dental office. Would you agree with me, Darren?
Absolutely, Gary.
Now, the best thing that you can do as a team is have all of your team members take this test and then run a team meeting around it and do that with your team. But the question was, how do we identify our patients? Actually, they're very easy to identify. So remember, we're going to have your team member who takes the call from the patient. We're going to have that team member listen through the filter of trying to identify their personality type. Ds talk very fast. They talk in sound bites. They aren't particularly conversational. Hey, I'm calling. I'd like to make an appointment. I like afternoons. That's a D. That's a D.
Right.
Another clue for a D, because of their driver personality, they tend to either own their own business or they work in a management level position. It could be the manager of a restaurant, but they tend to gravitate towards jobs where they have control. So the Ds, and again, they usually aren't. It's kind of they talk in sound bites, just the facts. That they aren't very conversational. The Is are very conversational. They want to know about you. They'll ask about your weekend. They tend to be the people persons. They tend to be talkative, social, outgoing, gregarious. They tend to dress in brighter colors. They don't blend in. They don't blend in. They don't want to blend in. They want to stand out. So the Is are pretty easy to find too, the people persons. The S's, they talk slower. The D's and the I's move fast. So when you're observing them in the practice, they move fast. They move quickly. The S's move slower. They're deliberate. They're calculated. They'll ask a lot of questions. And you can identify them. Remember, when in doubt, the odds are they're probably a high S because 40% of the population are S's. And then the C's are very analytical. They are the engineers of the world. How long is this appointment? What exactly is done during the appointment? How long does it take? They have lots of questions. The C's also move slower. They're more deliberate. And they will typically be the ones that will pepper conversations with lots of questions. So they're pretty easy to identify. Doctors, as you're listening to this, think about your team members and see if you can just guess, as I'm going through this, guess who on your team is a high D, high I, high S, high C, and then compare it to the results. When we go through the training with the team, I always ask the team members, hey, name someone in the practice that's a high I. Name someone that's a high D. Name someone high S, high C. And usually you can kind of get on with this flow pretty quickly. It's a fun way. Remember, there are no bad personality types. There are no bad. We want all of them. We want all of them on our team. We want all of them as patients too. Which patients are more faithful about keeping their appointments? D's or I's or S's or C's?
S's and C's.
Absolutely. In fact, I've done an experiment. It's not enough data to publish, but I've done a loose experiment. You don't even need to confirm S's and C patients because once they put it in their schedule, they're guaranteed. Now, don't do that. Don't do that until you get your arms around it. I still want you to confirm. The D's and the I's, the D, if something better comes up, guess what?
He's going to the other one.
The I is a different story. The I, she stopped at Starbucks on the way in. She met a new best friend. She got completely distracted with time and she forgot.
Right.
That's the I. I'm being playful with this. All of the personalities are great. All of the personalities are great. We need all of them.
One that provides personal, professional, and financial satisfaction.